Hello everyone, welcome back to our channel. So, today we will be talking about an amazing topic that is regarding the jaundice. So, we will see this jaundice. This is actually a medical condition that is characterized by the yellowing of the skin and the whitening of the eyes. And this is caused by an excess of bilirubin in the blood. Now this bilirubin, this is actually a yellow pigment that results from the breakdown of red blood cells. And when the bilirubin levels are elevated, it can lead to visible symptoms of jaundice. What are the causes of this jaundice? So first is the prehepatic, that is hemolytic causes. In this case, different types of anemia like the sickle cell anemia, thalassemia, and the spherocytosis, they increase the breakdown of the red blood cells. Now there comes the infections such as malaria or the sepsis that destroy the red blood cells. And afterwards there comes the hepatic causes. In this case, the liver diseases like the hepatitis, that may be viral or alcoholic hepatitis. Then comes cirrhosis and liver cancer that can also happen. There are also different types of genetic disorders like the Gilbert syndrome and the Nader syndrome. They can affect the bilirubin metabolism also. Sometimes infections like the leptospirosis and yellow fever, they can also affect. Then comes the post-hepatic or the obstructive causes. In this case, bile duct obstructions like different types of gallstones, tumors, or structures that can actually block the bile ducts. Some pancreatic cancers that can cause the bile duct compression also. There comes the inflammation of the bile ducts that is called as the cholangitis. So these are all the different types of the causes. And afterwards, we will see the symptoms of this jaundice. The first is the yellowing of the skin and eyes. So this is the primary visible symptom that you can see. There comes the dark urine, that is due to excess bilirubin being excreted through the urine. And afterwards there may be also the symptom of pale stools that are caused by lack of bilirubin in the intestines. And sometimes itching, that is due to bile salts that are deposited in the skin also. Now afterwards we will see the different types of fatigue and weakness that is often accompanied with the liver dysfunction. And now we sometimes see the abdominal pain, that is especially in case of the liver disease or bile duct obstruction. Now we will see the diagnosis of this jaundice. How can we diagnose this disease? So we have to look at the physical examination. Firstly, we will observe the yellowing of the skin and eyes. That is the first physical examination. And afterwards, we will proceed to blood tests. Different types of blood tests are done, where we see the bilirubin levels, the elevated total direct or indirect bilirubin concentrations. And after this bilirubin levels, we will go for the different types of tests like the liver function tests, LFTs, where we see the elevated liver enzymes like ALT, AST, ALP, and GGT. And after this, we will proceed towards the imaging studies, where we see the different types of studies. Like for example, we will go for ultrasound to check for bile duct obstructions or liver abnormalities. Then we will proceed for CT scan or MRI, where we see the detailed imaging to identify underlying causes. And after that, we will sometimes opt for the liver biopsy, where we see the different types of liver functions. And after that, we will see the treatment of this jaundice. Firstly, we will go for the medications to check for the infections, liver disease management, and hemolytic conditions. And after that, if this condition is severe, we will go for surgery for different gallstones, tumors, or bile duct obstructions. And this was all about this topic. Hope you have enjoyed this video.